particularly whatever hydroxymethylbilene will get converted into uroporphyrogen 3. Uroporphyrogen 3 under the influence of an enzyme called as uroporphyrogen decarboxylase. Uroporphyrogen decarboxylase, it will give rise to, what is that? It will give rise to something called as what is that? That is coproporphinogen. What is that? Coproporphyrogen 3. Okay. All right. So what is that? Carpoporphyrogen 3. Carpoporphyrogen 3. So because of this carpoporphyrogen, this will get further converted into, what is that? That will get further converted into, of course, that is into the heme. So let's look at that. So this coproporphyrogen 3 will get converted into protoporphyrin 9. Will get converted into protoporphyrin 9. Protoporphyrin 9 will get converted into heme under the influence of an enzyme called as ferrochelatase. Okay. So now if it is getting converted into heme, which iron is getting accumulated? That is iron Fe2 plus, sir. What is that? Fe2 plus. Fe2 plus. Fe2 plus is the iron which will get incorporated into, what is that? Incorporated into your, what is that? Into the heme. So they will ask you a question. If there is a Fe3 incorporated, if there is a Fe3 incorporation will occur, then we will call it as not as a heme, that's called as hemine. What is that called as? Hemine. That is called as what? Hemine. Okay. Now this heme, whatever is there, it will get converted into hemoglobin. All of us know that it will get incorporated into the RBC. So if there is a deficiency of this enzyme, what is that? Uroporphyrogen decarboxylase, it will create a disease called as porphyria cutana tarda. Porphyria cutana tarda. Porphyria cutana tarda. Porphyria cutana tarda is caused by what? Is caused by deficiency of uroporphyrogen decarboxylase. Uroporphyrogen decarboxylase deficiency leads to, what is that? Excessive accumulation of uroporphyrogen. Okay, uroporphyrogen. Excessive accumulation of uroporphyrogen will lead to porphyria cutana tarda and parfobilinogen defect. Parfobilinogen defect, deficiency of this enzyme leads to acute intermittent porphyria. Acute intermittent porphyria. Okay, so these are the two diseases. And whenever a person has a lead poisoning causes what is that? Basophilic stippling. Along with that, they will cause a lack of hemoglobin because they will inhibit an enzyme. It will inhibit an enzyme. Lead inhibits two enzymes. One is ferrochelatase, and it will also inhibit ALA dehydratase. But ferrochelatase is inhibited by your which enzyme? Lead poisoning. Hope this part is clear. समझ में आ गया? Can I go to the lipids now? Okay, perfect. Let's continue to the next one, lipids. So whenever we are speaking of lipids, first thing we need to understand is fatty acid. What is that? Fatty acid. Fatty acid is a long chain of carbon with one acidic group in it. Which is that acidic group? COOH. What is the functional group of a fatty acid then? That is your COOH. Anytime if you want to call it as a lipid is a combination of two things. One is your fatty acid and one more is your alcohol. Okay, COOH and OH, two functional groups will be there in the lipid. So lipid is a combination of fatty acid and alcohol. If fatty acid and alcohol present, then we will call it as a simple lipid. But we can have fatty acid, alcohol and other groups if they are there. Other group is there, then we will call it as a complex lipid. So if I'm talking about a lipid is a combination of fatty acid and alcohol. This fatty acid and alcohol combination, we will call it as a simple lipid. To that, if I add some carbohydrate, I will call it as a glycolipid. If I add a carbohydrate, then I will call it as a glycolipid. If I add a protein, then I will call it as then I will call it as lipoprotein. If I add a phosphate group to this, I will call it as a phospholipid. Okay. So when we are talking about the structure of the lipid, RCOOH, R means a long chain of carbon. COOH is the functional group. R and COOH together, we will call it as a fatty acid. Along with the fatty acid, we will have an alcohol that is usually glycerol, not Glenfiddich, that is glycerol. So glycerol is the OH group. So OH group, if you add, we are going to get a lipid. So this is the structure of the lipid. So we have complex lipid which we need to discuss. Complex lipids such as glycolipid. What is glycolipid? Glycolipid is a combination of fatty acid, alcohol and carbohydrate. Fatty acid, alcohol, and carbohydrate. If all three of them are combined, we will call it as a glycolipid. Now, carbohydrates are also types are there, right? Carbohydrates, how many types of carbohydrates we have? Now, what are the types of carbohydrates we have? Monosaccharides, we have disaccharide, we have oligosaccharide. Means fatty acid, alcohol, along with that we can have a monosaccharide possible, we can have a oligosaccharide possible, we can have a polysaccharide possible, right? So based on the which type of carbohydrate is there, these glycolipids are further classified into something called cerebrosides. Cerebrosides, my dear students, this is a combination of fatty acid, alcohol. Fatty acid and alcohol is a lipid. Along with that, if you have a monosaccharide, tell me some examples for monosaccharides. Come on guys, quickly tell me some examples for monosaccharides. Very good. That is your glucose, fructose, very good, and also your galactose. Very good, very good, very good. Okay, so let's look at this. Glucocerebroside is a combination of fatty acid plus alcohol plus your what is that glucose. If glucose is present, then we will call it as a glucocerebroside, called as a glucocerebroside. If fatty acid plus alcohol plus your galactose, if it is present, we will call it as a galactocerebrosides. We will call them as a galactocerebrosides. So now glucocerebrosides is metabolized by an enzyme called as beta glucocerebrosidase. Okay, so beta glucocerebrosidase metabolizes which one? Glucocerebrosides. So if there is a deficiency of beta glucocerebrosidase, we encounter a disease called as Gaucher disease, called as Gaucher disease. Galactocerebrosidase, galactocerebrosides are metabolized by galactocerebrosidase. Galactocerebrosides are metabolized by galactocerebrosidase. So galactocerebrosidase has a types, has a alpha subtype and beta subtype. Alpha deficiency causes a disease called as Fabry's disease. Beta deficiency causes Krabbe's disease. Beta deficiency causes Krabbe's disease. So cerebrosides is fatty acid, alcohol plus a monosaccharide. In that we have glucocerebroside and galactocerebroside. Glucocerebroside metabolism impairment lead to Gaucher disease. Galactocerebrosidase deficiency leads to Fabry's and Krabbe's disease. Fabry's and Krabbe's disease. Okay. So let's talk about the ganglioside. What is a ganglioside? So ganglioside is a type of glycolipid. So glycolipid means it should have fatty acid, alcohol, and carbohydrate. Here we will have a fatty acid, alcohol, and oligosaccharide. If oligosaccharide is present, we will call it as ganglioside, which are represented by an alphabet called as GM. Okay, it has types of gangliosides. We have GM1, GM2, GM3. GM1, GM2, GM3. So what is the role of GM1? What is the function of what does the GM1 ganglioside does in the body? What does it do? Anybody can recall? Anybody come on quickly? GM1 gangliosides role in the body. It is present in the, see, all the gangliosides are responsible for membrane protection, membrane function. Very good. All of you are correct. All of them are responsible for membrane function, but specifically GM1, some people told it works as a receptor. For which toxin? Cholera toxin. Works as a receptor for cholera toxin. All three of them are involved in what? All three of them are involved in the membrane function and nerve function. Okay, but GM1 ganglioside work as a receptor for the cholera toxin. Okay, so cholera bacteria is a monoflagellated or mono or polyflagellated? Cholera is a bacteria with monoflagellated or polyflagellated, means multiple flagellas are there. So one single flagella will be there. Very good. That is your mono. You people are absolutely correct. That is your monoflagellated. It is a motile bacteria which comes in the intestine, which forms a bad toxin called as cholera toxin. Cholera toxin inhibits which enzyme? Cholera toxin's mechanism of action. Mechanism of action. It will cause rice water diarrhea, sir. How will it cause rice water diarrhea? By acting upon which enzyme in the intestinal epithelium? Yes, it act on your an enzyme called as adenyl cyclase. Adenyl cyclase. So adenyl cyclase defect will lead to decrease of CAMP, which causes the secretion of plasma into the diarrhea, So hexosaminidase. So GM2 ganglioside is metabolized by an enzyme called as hexosaminidase. Hexosaminidase. If there is a deficiency of hexosaminidase alpha, we will get a disease called as Tay-Sachs disease. And beta hexosaminidase deficiency leads to Sandhoff's disease. Beta hexosaminidase deficiency leads to which disease? Sandhoff's disease. Alpha deficiency leads to Tay-Sachs disease. Okay. Among all three of them, which is the simplest one? Simplest is GM3. Simplest is the GM3 ganglioside. Okay. So Sandhoff and Tay-Sachs. Okay. Now, phospholipids. Phospholipids are present in your cell membrane. So phospholipids are divided into two types. One is, what is that? Sphingolipids. Can you tell me any other group of phospholipids which are present? Sphingolipid, and one more is there. Come on, quickly recall. याद नहीं आ रहा है? Very good. That is called as glycerophospholipid. Glycerophospholipid. So sphingolipid के लिए classic example sphingomyelin. Okay. ये सारे तुम्हारा notes में मत लिखा करो. Don't write it. It's all present in your notes. I just want you people to recall them. That's why I'm writing them here. So sphingomyelin and also glycerophospholipid example, we have something called as lecithin and cephalin. So these are the proteins which are present where, sir? Which are group of glycerophospholipids. So Niemann-Pick's disease is due to deficiency of sphingomyelinase. So sphingomyelinase, in which kiska metabolism is impaired? Impairment of sphingolipids. That is your sphingomyelin. Sphingomyelin is metabolized by an enzyme called as sphingomyelinase. Its deficiency can lead to which disorder? It can lead to a disease. The name of the disease is your, what is that? Yes, that is called as a Niemann-Pick's disorder. Niemann-Pick's disease. Okay. All right. Phospholipids present in the cell membrane is phosphatidylserine. Okay. So present in the inner side of the cell membrane. As I have told you people, so cell membrane has two layers, outer layer and inner layer. So phosphatidylserine. So if you consider this is the cell. Okay. This is a cell. So there is a outer membrane and there is a inner membrane. So phosphatidylserine is present on the inner membrane, which comes out only during apoptosis. What is apoptosis? It is a process of programmed cell death, which is most of the time physiological, but sometimes it can be pathological also. Okay. Then so to find out this phosphatidylserine, we use a special stain. The name of the stain is called as annexin stain. Okay. So that is the story of your, what is that? Phospholipids. Then we have lipoproteins. Now lipoproteins, my dear students, we have fatty acid, alcohol and protein. So the proteins which are present in the lipoprotein, we call them as which proteins, sir? Apoprotein. Apoprotein. So apoprotein present, there are types of apoprotein such as B48, okay, B100, apoprotein C, apoprotein E. Okay. Then there is also apoprotein C and E. Okay. All right. So types of lipoproteins. We have chylomicron. Chylomicrons are formed in the intestine, which carry the cholesterol from the intestine to the liver, which carry the fats from the intestine to the liver. Very low density lipoprotein has a triglyceride cholesterol. Along with that, apoprotein B100 will be present. Yes, students, don't get confused. Apoprotein B100. IDL is the intermediate density and LDL is the low density. All three of them have a bad effect. They're called as a bad cholesterol. Why they're a bad cholesterol? Because what will they do? They take the cholesterol from where to where? Take the cholesterol from the liver to the tissues. to the tissues. So since they are taking to the tissues, so this can lead to, what is that? This can lead to diseases like atherosclerosis. But high density lipoprotein, we will have apoprotein A, C, and E. Apoprotein A, C, and E. Here you can add apoprotein A if you want to. So apoprotein A, C, and E, all of them are present in your high density lipoprotein. So this HDL is a good cholesterol or a bad cholesterol? It's a type of good cholesterol because it causes reverse cholesterol transport. It causes reverse cholesterol transport, reverse cholesterol transport, reverse cholesterol transport occurring through, what is that? High density lipoprotein occurs to your high density lipoprotein. So high density lipoprotein. Now in the lipoprotein, we have apoproteins, right? What are they doing actually? Okay. When, for example, we have a very low density lipoprotein, it took the cholesterol, went into some tissue. The very low density lipoprotein took the cholesterol, went into tissue. After it goes into the tissue, these apoproteins which are present in the lipoprotein, they start to interact with the cell receptor. They start to interact with the cell receptor. Say cell receptor, which is that is only called as PPAR receptor. Paroxysmal proliferative activator receptor. Specifically, they interact with PPAR alpha. PPAR alpha. Can anybody tell me which drug is a PPAR gamma agonist? PPAR gamma agonist. Come on, tell me. Which drug is a PPAR gamma agonist? Which one? Very good, Manivel. The answer is pioglitazone. What is that? Pioglitazone. Pioglitazone is a drug which is used in the treatment of diabetes mellitus. So it is a pioglitazone. It's a pioglitazone. It's a pioglitazone. PPR alpha agonist is which one? PPR alpha agonist कौन सी होती है? PPR alpha agonist. We have discussed this. Very good. That is your fibrates. PPR alpha agonist are fibrates, bacho. What is that? Fibrates. Fibrates are PPR alpha agonist. Alpha agonist. Okay. So they interact with the receptor and causes the cholesterol to break down. Then they can activate the enzymes such as lipoprotein lipase. Lipoprotein lipase. Lipoprotein lipase is activated by apoprotein C. Then they can also activate LCAT enzyme, lecithin cholesterol acyl transferase, that is activated by an enzyme called apoprotein called as apoprotein A. Apoprotein A. All right. Let's talk about the synthesis of the cholesterol. Synthesis of the cholesterol, again, this is a important thing with respect to pharmacology only. So with respect to biochemistry, less frequently asked question, but with respect to pharmacology, there is a very important point to be remembered. So in your body, if you don't take the cholesterol from your diet, you avoid the cholesterol. मैं diet करूंगा, मैं diet करूंगी, मैं I will not eat any cholesterol containing food. Body बोलेगा ठीक है, ठीक है. So what your body will do? Body will start to synthesize the cholesterol on its own. Okay, so what your body will do, my dear students, we have your acetyl CoA. We have your acetyl CoA. Acetyl CoA comes from where? Acetyl CoA comes from your carbohydrates, that is from your glucose. This acetyl CoA, two molecules of acetyl CoA will be taken up. Okay, so this acetyl CoA will get converted into HMG CoA. HMG coenzyme A. This HMG coenzyme A will get converted into mevalonate. This mevalonate will get further converted into cholesterol. It will get further converted into cholesterol. So for that we require an enzyme called as a HMG CoA reductase. We require an enzyme called as HMG CoA reductase. So this HMG CoA reductase will convert HMG CoA to mevalonate. HMG CoA reductase. So this is the enzyme which is required for what? Synthesis of the cholesterol. That is the rate limiting enzyme. Sir, what exactly is important here for us? This enzyme is active. कब active होता है? कब active होता है? When it will be active? Active at night. Active at night. रात में बहुत active होता है. Active at the night. At night, very active. Okay, this enzyme is very active in the night time. Okay, अरे enzyme का बात कर रहा हूँ भाई, active at night. I'm talking about the enzyme. Okay, HMG CoA reductase. So this HMG CoA reductase, there are some inhibitors. So who will inhibit the HMG CoA? Who will inhibit the HMG-CoA? HMG-CoA is inhibited by your statins. Which ones? Statins. Okay, very good, very good. All of you are correct. Sandeep, Viren, Munir, all of you are absolutely correct. The answer is, what is that? Statins. Statins inhibit the HMG-CoA reductase. Okay. Now, whenever fatty acids are there, fatty acids undergo breakdown. Fatty acids undergo breakdown. So, breakdown of the fatty acids for purpose of what? To get energy. To get what is that? Energy. So basically we want to get the energy. For getting of energy, we have fatty acid oxidation. Okay, so that fatty acid oxidation occurs, occurs with the help of what? With the help of your mitochondria. What is that? Mitochondria. Okay, so with the help of mitochondria, so if they ask you where does a fatty oxidation occurs, major organ is your, very good, that is your major organelle is your mitochondria. That is your mitochondria. Okay, so mitochondria is the place where major conversion will occur. Okay, so let's talk about what is that. Let's talk about your fatty acid oxidation. Fatty oxidation, most common type is, predominant type is beta oxidation. The common type of oxidation is beta oxidation, which is a predominant type. Okay, then alpha oxidation is the minor type. It's a minor type. Omega oxidation is active during, yes, active during your, very important, which one? Starvation. Active during starvation. Okay, active during the starvation. So what happens here is that it will break the fatty acid, and forms the acetyl CoA. So that acetyl CoA will enter the Krebs cycle. From the Krebs cycle we can get the energy. Simple as that. We have fatty acid, we need to break this fatty acid. Fatty acid is what? Long chain of carbon. Now this is a long chain of carbon. Now I need to break this long chain of carbon and make it into small molecules of acetyl CoA. So this acetyl CoA can enter into, yes, they enter into your Krebs cycle. Now Krebs cycle will do, what is that, sir? Krebs cycle will do one important thing. What will it do? It will produce NADH and FADH that will enter into electron transport chain and forms the energy. So the main target is for the energy only. Okay, all right. So what are the stages? The stages is activation. Activation of the beta oxidation occurs in the cytoplasm. So consider this is your cell. In the cell we have mitochondria and the cytoplasm, right? In the cytoplasm activation occurs. So fatty acid is activated. So this fatty acid which is activated will be transported into the mitochondria. So the transport of fatty acid from the cytoplasm to the excuse me, sorry. So fatty acid oxidation, fatty acids which are activated will transfer from the cytoplasm, enter into the mitochondria. That transport of fatty acid from the cytoplasm to the mitochondria is done by something called as carnitine shuttle. What is that called as? Carnitine shuttle. Okay, so that is why when you go to gym and all, as a weight loss promoting agent, they will give you some substance called carnitine. Actually is what? It is making the activated fatty acids to go from cytoplasm to mitochondria. Okay, then inside the mitochondria breakdown takes place. We call it as a beta oxidation proper. So once we discussed about it, let's talk about your alpha oxidation. Students who are attending from, especially the batch of students in Delhi, for you people, तो तुम्हारा नोट्स पे नहीं होगा शायद ये वाला, तो इसको ऐड कर लो. सो दिस वन वी स्टार्टेड टू नोटिस रिसेंटली. इन रिसेंट टाइम्स में हम नोटिस करने लगे. वी स्टार्टेड टू नोटिस इट रिसेंटली दैट they started to ask questions related to alpha oxidation disease. So let's understand. Alpha oxidation is a minor type. अगर इसका defect आएगा, if there is a defect of alpha oxidation, it will lead to disease called as Refsum disease. Which disease? Refsum's disease. What is Refsum's disease? Refsum's disease is not a newer disease, but it started to become into the questions. So let's understand. Refsum's disease is a disease which occurs as a result of which defect? Defect of alpha oxidation. So alpha oxidation. In the alpha oxidation, we have phytic acid. Phytic acid is predominantly present in the foods. Predominantly, it is present in the. This phytic acid, whatever is there, will undergo something called as alpha oxidation first. Alpha oxidation first. So after it undergoes the alpha oxidation first, it will give rise to something called as a phytinic acid. What's called as phytinic acid. Now this phytinic acid can enter into beta oxidation. It can enter into beta oxidation. So if at all there is a defect of alpha oxidation, if at all there is a defect of alpha oxidation, so what will happen if there is a defect of alpha oxidation? That will lead to phytic acid accumulation. Phytic acid accumulation in the body. Phytic acid accumulation in the body. So it will lead to disorders such as with the eye. Okay, so it will lead to disorders with the eye, it will lead to disorders with the skin, it will lead to disorders with the joint. So basically everywhere phytic acid will start to accumulate. In all the places it will start to have the problem. So that is what, that is only called as a refsum disease. So first alpha oxidation hoga, alpha oxidation, after alpha oxidation phytic acid will enter into beta oxidation. If there is a defect of alpha oxidation, so if there is a defect of alpha oxidation, automatically phytic acid will not metabolize, it will rather increase, and for increased phytic acid will start to accumulate in the body, which will affect your, yes, it will affect your joints, okay, skin, eye, okay. So all of these places will be affected. Clear? Any confusion, sir? Any confusion? Can I continue? Okay. Let's continue to the next aspect. What is the next aspect? Let's see. So first thing we discussed was your, that is your, this one was done. Let's continue to the next concept. That next concept is your vitamins. So vitamins, for your understanding, I have put there, what is that? I have put the vitamins there. So let me just quickly recap your all the vitamins. Specifically speaking, all the vitamins, I would like to recap about your, that is your vitamins functions, like what is the function of the vitamin and what is the disease we are going to get. Let's understand. Okay, so first thing we have vitamin A. Vitamin A is also called as retinoic acid, which can be found in the form of retinol and retinol. All of you remember that. Okay, so this vitamin A, whatever is there, sir, vitamin A. So source of the vitamin A, so in the source, of course, leafy vegetable, leafy vegetables. Okay, but there is one more fish thing, halibut liver. Halibut liver is the richest source of vitamin A. It is the richest source of your vitamin A. Now vitamin A function, what is that? Vitamin A function, okay. Vitamin A function is for your, of course, antioxidant. So don't write all of it, already it is there. Antioxidant, it is responsible for mucosal healing, okay. It is also responsible for vision, deficiency leads to, which are all the most important points to be remembered here. Deficiency leads to, it will lead to, what is that? Yes, first one is xerosis of the eye. Dryness of the eye is the first complaint. Later it can progress into something called as bite spot. If left untreated, night blindness will be there. So of course I have given you the stages. So for you to remember important points I'm going through here. So dryness in the eye, bite out spot, night blindness, and also other symptoms like corneal xerosis, corneal ulcer. At last it will cause xerophthalmic fundus. Also possible. So this is the story of your vitamin A deficiency. Xerosis of the eye, bite out spot. They will ask you what is bite out spot. Bite out spot is what? What is bite out spot made out of? Bite out spot किस चीज से बनता है? Come on, everybody. Very good. That is keratin spot or hyperkeratotic spot. Hyperkeratotic spot. Keratotic spot. Okay. Hyperkeratotic spot is the most important thing. Bite out spot is made out of keratin. Okay, whenever there is a vitamin A deficiency, in all those cases, remember keratin will start to deposit in the body. Okay, so excessive keratin will be present in the body. Okay, all right. Once we understood about this, let's continue to the next important aspect, that is vitamin D. Vitamin D. Vitamin D synthesized from what is that? So in the skin, we have something called as 7-hydroxy cholesterol. 7-hydroxy cholesterol will be there. So upon the sunlight, what it will form? Upon exposure to the sunlight, it will form something called as, yes, can anybody tell me? That is called as cholecalciferol. Cholecalciferol. So cholecalciferol undergoes hydroxylation, addition of OH group in the liver, Once it undergoes hydroxylation in the liver, it will give rise to hydroxycholecalciferol. Okay. So this hydroxycholecalciferol undergoes hydroxylation once again. In where? In the kidney. Undergoes hydroxylation in the kidney. It will give rise to 1,25 dihydroxycholecalciferol. Okay. Yes, this is 25th carbon, of course. So this is 25th carbon. Here we will have 1,25 dihydroxy cholecalciferol. So dihydroxycholecalciferol, it is only called as active vitamin D3. Vitamin D3. So what is the function of vitamin D3? Overall calcium levels in the body will rise. So it will increase the calcium absorption. It will increase the calcium absorption where, sir? In the intestine. And also it will increase the calcium reabsorption in the kidney. Because of that, there will be increased level of calcium in the blood, sir. Okay, so calcium level in the total body calcium will rise. So deficiency leads to diseases. Deficiency leads to which disease? Deficiency leads to rickets in children. So in the children, there are clinical features. What are the clinical features? It affects the small bones or large bones. Usually which bones are affected? Large bones. Usually large bones are affected, but it can affect the small bones also. So this fontanel's healing will be delayed. Fontanelle healing is delayed. Then there is a defect of the bones. Okay, then there is something called as a rachitic rosary. Rachitic rosary is possible. And there can be deformities such as genu varum and genu valgum. So rickets is seen in children, sir. Okay, let's talk about the next one, that is your adults. So in the adults, what disease we get? We call it as a osteomalacia. So less exposure to sunlight, it will lead to osteomalacia in adult. In osteomalacia in adult, there is one X-ray sign which you need to remember. What is the X-ray sign in osteomalacia? I have taught it in biochemistry itself. Come on, tell me what is that? Very good. What is that? That is your loser zone. What is that? Loser zones. So loser zone is also called as pseudo fracture. It looks like a fracture, but it is not a fracture. Pseudo fracture. On the X-ray, it will appear like a real fracture is there, but actually that is not a fracture. That is due to osteomalacia that has occurred. That is only called as loser zones. Okay. So this is your vitamin D. Then let's talk about vitamin K. Vitamin K is responsible for what? Responsible for formation of what is that? Responsible for 2, 7, 9, 10 clotting factor formation. 2, 7, 9, 10 clotting factor formation. Okay, formation. By which process? Formation by a process called as, by something called as gamma carboxylation. Gamma carboxylation. So gamma carboxylation of 2,7,9,10 is done by your, very importantly, vitamin K. So if vitamin K is there, clotting factors are formed in more quantity. If more quantity of clotting factors are formed, automatically that will lead to what? That will lead to coagulation. So vitamin K is a coagulant. Vitamin K is a coagulant. Vitamin K is a coagulant. Okay. Now, once we know about vitamin K is a coagulant, what are the points which we need to recall for the exam point of view? So the first point is vitamin K is the antidote for which antidote for which poison? Antidote of warfarin. Antidote of warfarin, and vice versa. Okay, and vice versa, because warfarin is the antidote for vitamin K overdose. Very good. Vitamin K is the antidote for warfarin overdose. Okay, that is point number one. So for the newborn, for all the newborn, we give what is that? Intramuscular vitamin K is given. Vitamin K is given because for all the newborns we need to give vitamin K to prevent which disease? To prevent which disease? Hemorrhagic disease of the newborn. Okay, very good. All of you are correct. So hemorrhagic disease of the newborn. So to prevent that from happening, we need to give. Okay, so that is for the to prevent hemorrhagic disease of the newborn. Why to the newborn? Hemorrhagic disease of newborn. Why? Because in the newborn vitamin K is absent, because vitamin K, source of the vitamin K, it comes from somewhere. What is that? Vitamin K comes from where? Vitamin K comes from your intestinal microflora. Okay, so intestinal microflora is there. So that intestinal microflora, if that is not there, sir, intestinal microflora, so no vitamin K, so the children can develop hemorrhagic disease of the newborn very easily. So that is the story of your vitamin K. Then vitamin E. Vitamin E is also called as, what is that? Tocopherol. What is that called as? Tocopherol. Okay, किसी को मत ठोकना. Tocopherol is the name of your vitamin E. Okay, tocopherol. So this tocopherol, my dear students, this vitamin E, tocopherol, is a most among all the vitamins potent antioxidant. Very potent antioxidant. And also it has uses. There are some uses. It is used in non-alcoholic fatty liver disease. Okay, it is used in cosmetics. It is used in the cosmetic purposes, and along with the cosmetic purposes, it is used in non-alcoholic steatohepatitis. Same thing. NASH or NAFLD, same thing. So a NASH is nothing but non-alcoholic steatohepatitis. NAFLD is nothing but non-alcoholic fatty liver disease. Same other names for the same disease. Okay, very good, you guys, very good. Now, not clinically seen. We don't see it clinically, but possible if there is a deficiency. Then it will lead to, in a healthy individual, if there is a deficiency, it can lead to infertility, but not clinically proven, not frequently you are going to get. So it can lead to infertility. They will tell you, yes, maybe, but very rare cases, they won't ask you. But to be on a safer side, I have told you people. Okay, so we are done with the vitamin A, D, E, K. So we are done with the fat soluble vitamins. Let's go to the water soluble vitamins. So water soluble vitamins, my dear students, we have vitamin B1. B1 is also called as thiamine. Now, thiamine, I'm not going to confuse you with much of the information. I will talk only about deficiency with the disease, because all the B vitamins are there asking you people deficiency, disease, and diagnosis or treatment. So this has been very, very common. Okay. So if it is a deficiency, if it is there, if both peripheral and central. If it is both peripheral and central deficiency, then we are getting which disease? Come on, you should be active in this one. Thiamine deficiency leads to which disease? Everybody should tell. So correct answer, you guys. What is that? Berry. What is that? Berry. Okay, berry. Now berry is can be divided into two types: dry berry and wet berry. Wet berry is a condition where we will have what is that? Very good, dry and wet. So in the wet there is a involvement of CVS. CVS is affected, cardiovascular system will be affected. That will lead to berry. So if there is a deficiency, so that is if it is central, due to what? Due to alcoholism. Due to alcoholism, it will lead to which disease? Alcoholism. Due to alcohol intake for a long period of time, it will lead to Wernicke's encephalopathy. Wernicke's encephalopathy. So Wernicke's encephalopathy is the condition what you are going to encounter. So Wernicke's encephalopathy is associated with the symptom Wernicke's encephalopathy and Korsakoff psychosis. Korsakoff psychosis. Both are possible. So Wernicke's encephalopathy, bachcho, it will be associated with global confusion. Means patient will have a confusion. So he will have a ophthalmoplegia. Ophthalmoplegia. What is ophthalmoplegia? It is a condition associated with vision disturbance and even pain also possible, and loss of balance called as ataxia. I have given a technique to remember. All of you know this mnemonic, GOA. So GOA is a mnemonic for which disease? Wernicke's encephalopathy. Okay, let's go to the next vitamin, sir. Because the people who takes long-term chronic alcoholism is there. So what happens is that they won't take the food properly. If they, because of that, what will happen is that the patient, the tissues will be starving. Starving from due to lack of glucose. Okay, their basal glucose level will be usually low. Okay, so that is why we add thiamine with glucose. Understood, Jagdish? That is for Wernicke's encephalopathy, because they will be having a starvation. To treat the starvation condition, we are adding a glucose. Hope that is clear. Okay, хорошо. Let's continue. Let's go to the next one. Vitamin B2. B2 is also called as riboflavin, called as riboflavin. BT is also called as riboflavin. Okay, so riboflavin is what? Riboflavin is a vitamin B2. Riboflavin is a vitamin B2. Okay, so riboflavin is a vitamin B2. This vitamin B2 deficiency leads to what? Deficiency leads to one important clinical feature. I taught you people, remember? Yes, chiliosis are also called as angular stomatitis. Angular stomatitis. It will be usually present alone. Angular stomatitis are also called as chiliosis. What is that? Chiliosis. Very nice, guys. Okay, angular stomatitis or chiliosis. Okay, let's go to vitamin B3. B3 is also called as niacin. B3 is also called as niacin. B3 is also called as niacin. Okay, B3 is also called as niacin. So niacin is a vitamin produced from what? Produced from your one amino acid called as tryptophan. Amino acid called as tryptophan. What is that? Tryptophan. Okay, produced from amino acid called as tryptophan. And tryptophan related वहां पे मैं डिस्कस इसीलिए नहीं किया था क्योंकि tryptophan related derivative मैं यहाँ पे पढ़ा दूंगा आप लोगों को. Tryptophan derivatives are niacin, that is vitamin B3. Then tryptophan will also produce your melatonin. What is that? Melatonin. All right, then we have one more important point: tryptophan, melatonin and serotonin. Okay, serotonin. So all of them are produced by which amino acid? That is your, very good, that is your tryptophan. So melatonin analogs, where do we use? Melatonin analogs का use कहाँ पे होता है? Analogs used for अरे पढ़ाए हो, बताओ बच्चों, जल्दी बताओ. Melatonin analogs are used for, देखो, it is for both of them. Blind people with sleep wake cycle disturbance are non-blind, for both of them, for the treatment of sleep wake cycle defect. Sleep wake cycle defects. Sleep wake cycle defects. So for the defect of sleep wake cycle treatment, we use what is that? Melatonin analog. We have a drug called as Ramelton. What is the name of the drug? Ramelton. Ramelton पहले पूछा गया है sir, confuse मत होना. Ramelton. What is that? Ramelton. Okay. अगर मान के चलो non 24-hour sleep wake cycle. What do I mean by non 24-hour sleep wake cycle disturbance? Non 24-hour sleep wake cycle. So non-24-hour sleep wake cycle means the people with a blindness. So this is non-sleep wake cycle, non-24-hour sleep wake cycle disturbance. Disturbance is seen with what? Disturbance is seen with your blind people. Okay, in the blind people. Okay, so for that drug of choice is not Ramelton. For that drug of choice is different one that is called as Tosimelton. What is that? Tosimelton. Tosimelton. This has been a previously asked question. Tosimelton is a type of drug which is doing what? Yes, which is causing which is used for the treatment of non-24-hour sleep-wake cycle disturbance. For the normal sleep-wake cycle disturbances, we can use Ramelton. And this was a previously asked question, so don't get confused, sir. Clear, everybody? Understood about your niacin now and tryptophan? Okay, now niacin related. So deficiency leads to which disorder? Niacin deficiency. Niacin deficiency leads to which disorder? Come on, quickly tell me. So niacin deficiency leads to pellagra. What is that? Pellagra. It will lead to pellagra, which includes dermatitis, dementia, diarrhea. Dermatitis, dementia, diarrhea, and also if you left untreated, death will also occur. Okay, so 4Ds, diarrhea, dementia, death. Okay, and also we will have a patient to have what is that? Dermatitis, and especially in the neck we have something called as Cajal necklace. What is that called as? Cajal's necklace. Cajal's necklace are also called as Casal necklace. Same thing, Casal necklace also they pronounce it. Okay. Casal necklace or Cajal necklace appearance is seen in the neck. Okay. So please be careful with the vitamin B3. Don't get confused. So tryptophan deficiency. Tryptophan deficiency leads to heart nerve disease. हार्ट नर्व्स डिसीज. ट्रिप्टोफैन डेफिशिएंसी लीड्स टू हार्ट नर्व्स डिसीज. ठीक है, अब ये सब बैठ के मत लिखा करो, मैं एक्सप्लेन करने के लिए लिख रहा हूँ. इट डजंट मीन दैट यू हैव टू राइट. माय डियर स्टूडेंट्स, डोंट राइट. आपका ये सारे इंफॉर्मेशन, इवन एडवांस्ड इंफॉर्मेशन इज रिटन इन द नोट्स, तो लिखने के लिए टाइम वेस्ट मत कीजिएगा बस. ओके, ऑल राइट, वेरी गुड, करेक्ट आंसर. दैट्स योर डेफिशिएंसी लीड्स टू हार्ट नर्व्स डिसीज. चलिए, लेट्स गो टू द नेक्स्ट इंपॉर्टेंट. B3 is done. Then we'll go to next one, B5. B5. What is that? B5 is also called as vitamin B5 is also called as pantothenic acid. What is that? Pantothenic acid. Pantothenic acid. So pantothenic acid. So we need to remember only one important aspect. Deficiency leads to which disorder? Deficiency. Deficiency leads to restless leg syndrome. Sorry, not restless leg syndrome. This is the point where everyone will get confused. Burning foot syndrome. What is that? Burning foot syndrome. Burning foot syndrome, which is also called as Gresham-Gopalan syndrome. What is that called as? Gresham-Gopalan syndrome. Gresham-Gopalan syndrome. Burning foot are also called as Gresham-Gopalan syndrome. Okay. So this is a story of your, what is that? Gresham-Gopalan syndrome are also called as burning foot syndrome. Okay. Now, restless leg syndrome कब आता है sir? रेस्टलेस लेग सिंड्रोम कब आता है बताओ? रेस्टलेस लेग सिंड्रोम इज ए साइड इफेक्ट ऑफ, किसी एक का साइड इफेक्ट होता है. रेस्टलेस लेग सिंड्रोम इज ए साइड इफेक्ट ऑफ समथिंग. नहीं, B12 में नहीं होता है, याद रखो. रेस्टलेस लेग सिंड्रोम कैन बी सीन विथ a disease called as seen with antipsychotic usage. Antipsychotics can give rise to restless leg syndrome. Okay, very good answer. Antipsychotics. Shalom, let's continue. B5 is done. Vitamin B6. Vitamin B6 is which one? B6 is also called as pyridoxine. What is that? Pyridoxine. Pyridoxine. Okay, that is your B6, pyridoxine. Very good, very good. So when we are speaking of pyridoxine, sir, pyridoxine. So this is a vitamin B6. Now this vitamin B6, sir. So I want you to remember deficiency. What is that? Deficiency. Okay, deficiency of what? Deficiency of B6 and also excess have same symptom. Deficiency and excess, both of them will be same symptom. Okay, same symptom. So that will lead to peripheral neuropathy. Main symptom is peripheral neuropathy. Peripheral neuropathy. Okay, so both excess of B6 and deficiency of vitamin B6 will lead to peripheral neuropathy. This has become very common with which group of people? Which has become very common with the people who are using vitamin supplements without monitoring. If they take longer higher doses of vitamin B6, higher dose of B6 injection will lead to what is that? Yes, that will lead to deficiency, will lead to deficiency and excess, both of them will lead to neuropathy. Deficiency causes what can it lead to? Deficiency due to two important things, due to two important aspects. One is your INH, isoniazid. INH, that is isoniazid. Okay, and also deficiency is due to alcoholism. It can also lead to alcoholism. And we have other important, like other diseases, like IBS and all. I agree, but main two important causes are INH and alcoholism. Okay, so INH, what it does, it prevents the utilization of vitamin B6. It prevents the utilization of vitamin B6, that is your B6 and pyridoxine story. Okay, so the next important aspect, that is your vitamin B7, are also called as biotin, are also called as biotin, are also called as biotin. So biotin is a vitamin B7. Vitamin B7 biotin, what will happen? Deficiency leads to alopecia. Deficiency leads to alopecia. Alopecia. Deficiency leads to alopecia, hair loss. And seen with which people? Raw egg consumption. Seen with raw egg consumption, because raw eggs के अंदर एक compound होता है avidin. Avidin will cause the decrease of biotin. Avidin, raw eggs will have a compound called as avidin. Avidin करता क्या है? Avidin prevents the absorption of B7. So avidin decreases the B7 absorption. So that is seen with the raw egg consumption. So simply for every hair loss, putting biotin is not useful, because if it is B7 deficiency, then your biotin treatment will help. If not, it won't help you, sir. Okay. Very good. Alopecia. Alopecia is the clinical. Let's go to the next one, vitamin B9. Vitamin B9. Vitamin B9 is also called as folic acid. Is also called as folic acid. Is also called as folic acid. Folic acid. Okay. So what is this folic acid? Folic acid usually absorption takes place in the jejunum. Absorption usually occurs in the jejunum. Jejunum is the main part, but apart from jejunum, other places also it can get absorbed, such as terminal ileum and jejunum. Terminal ileum and jejunum is the place where folic acid gets absorbed. So folic acid, once you eat the folic acid from the food, so folic acid will get converted into what is that? Something called as dihydrofolate. Dihydrofolate. This dihydrofolate will form. What is that? Will be responsible by an enzyme called as DHFR, dihydrofolate reductase. So this dihydrofolate will get converted into tetrahydrofolate. What is that? Tetrahydrofolate. Very good, very good. Tetrahydrofolate. Again, with the help of same enzyme, dihydrofolate reductase. Same enzyme, dihydrofolate reductase. This tetrahydrofolate will form. What is that? Methyl tetrahydrofolate. Methyl tetrahydrofolate, which is responsible for your TMP synthesis. What is that? TMP synthesis. TMP synthesis. What is TMP? Thymidylate monophosphate. TMP synthesis. How it will occur? We have something called as uridyl monophosphate that will get converted into TMP, thymidylate monophosphate, with the help of an enzyme called as thymidylate synthase. thymidylate synthase. Okay, that is the enzyme which is responsible for the synthesis of UMP2 thymidylate monophosphate. This thymidylate monophosphate is what? It is a type of nucleotide. This nucleotide help in what is that? Nucleotides help in the replication of the cell, and also this methyl tetrahydrofolate helps in the metabolism of which amino acid? Metabolism of which amino acid? Come on, tell me quickly. Tell me. Cheppandi. Solunga. Bolo. Metabolism of which amino acid? Metabolism of one carbon reaction. Metabolism of sulfur containing amino acid. Very good. Metabolism of sulfur containing amino acid are also called as, yes, metabolism of methionine and homocysteine. Methionine and homocysteine. For the metabolism, we require what is that? For that, we require, that is your metabolism of methionine and homocysteine requires your methyl tetrahydrofolate. Okay. So the first important point to be understood, deficiency of B9. Deficiency of B9 leads to which diseases? So deficiency leads to megaloblastic anemia. Megaloblastic anemia. In the megaloblastic anemia, agar aap log, if you take a blood sample and look under the microscope, you get a characteristic finding with any megaloblastic anemia. Koi bhi megaloblastic anemia ke andar characteristic finding you are going to get is hypersegmented neutrophil. Hypersegmented neutrophil. Hypersegmented neutrophil. Okay. Megaloblastic anemia will be there. Megaloblastic anemia. Okay. Then if the deficiency occurs in the pregnancy, if in the pregnancy, then it will lead to what is that? Come on, everybody should be able to tell me. Yes, it will lead to neural tube defect. It will lead to neural tube defect. So इसीलिए as early as possible हम लोग क्या शुरू करवा देते हैं? We start the patient on folic acid if they are having a plans of getting pregnant. Okay, so this is the story of your megaloblastic anemia. Now, once we understood about this deficiency and megaloblastic anemia by B9, then if there is a deficiency, there is an increase of one compound called as, what is that? Homocysteine. Compound called as homocysteine. Compound called as, what is that? Homocysteine. Homocysteine level will be elevated, and normal level of methyl malanoic acid, MMA, will be normal, but homocysteine will be elevated. So this is a very important point with the B9 deficiency. With the B9 deficiency, here only thoda clinical correlations लिख लेते हैं. Clinical correlations थोड़ा पढ़ लेते हैं. Clinical correlation. So there is something called as DHFR. DHFR, dihydrofolate reductase, is inhibited by which drug? Inhibited by, come on, which drug? कौन सी ऐसा ड्रग है DHFR को ब्लॉक कर देता है? Which drug blocks the DHFR? Everybody should be able to tell what is that? MTX. What is that? MTX. Very good. That is methotrexate. What is that? Methotrexate. Methotrexate. Okay. Then there is one more drug. Nowadays it has come. Newer drug. Prematrexate. Prematrexate. Both of them can inhibit the dihydrofolate reductase. Okay. Methotrexate agar overdose ho gaya. Methotrexate overdose ho gaya. So if there is an overdose caused by methotrexate, what is the treatment, sir? Treatment. So will you give folic acid or not? Will you give folic acid or will you give something alternative? You are going to give something alternative. Very good. Very good. You people are correct. All of you are correct. What is that? You are going to give a leucovorin, which is also called as folinic acid. Folinic acid, not volini. That is folinic acid. That's your folinic acid, which is also called as leucovorin. What is that called as? Leucovorin. Leucovorin. Leucovorin is also called as folinic acid. Leucovorin is also called as folinic acid. Okay, so that is the story of your, what is that? Story of your, yes, story of your methotrexate. Then let's go to the next one. So can anybody tell me thymidylate synthase is there, right? Thymidylate synthase. Thymidylate synthase inhibited by. Synthase is blocked by which drug? Thymidylate synthase is blocked by which drug? Thymidylate synthase. Any guesses, sir? Any guesses? कुछ तो guess करो. अरे thymidylate synthase को inhibit कर रहे हो. You are inhibiting the thymidylate synthase by which drug? Thymidylate synthase is an enzyme. Synthase is an enzyme inhibited by a drug. Any idea? No guess? Anyways, don't worry. It is inhibited by a drug called as 5-fluorouracil, 5-FU. What is that? 5-fluorouracil. They will cause the thymidylate synthase inhibition. They'll cause what is that? Thymidylate synthase inhibition, 5-FU, 5-fluorouracil. 5-fluorouracil. Okay. So this is the story of your B9. Let's go to the last but not the least. Which enzyme? Which one? B12. B12 is also called as cyanocobalamin. Cyanocobalamin. So this cyanocobalamin is a vitamin B12. This vitamin B12 is responsible for what? Let's see. It is responsible. This is absorption of the B12. Absorption. Where does absorption occur? Absorption. Absorption occurs in the duodenum. Absorption occurs in the duodenum. Okay. If it occurs in the duodenum, so with the help of what? With the help of intrinsic factor. What is that? Intrinsic factor. Intrinsic factor कौन produce कराता है? Intrinsic factor from which cell? From which cell? From your parietal cell. From your parietal cells. So parietal cells of the stomach produces intrinsic factor. Intrinsic factor. This intrinsic factor ileocecal junction में भी होता है, ileocecal junction में भी होता है, and also in duodenum also in duodenum and also in the ileum. ठीक है, ileum में भी होता है. So ileum में भी होता है, small amount in duodenum also. तो अगर ऐसा लगता है आपको कंफ्यूज हो रहा है तो एक ही लिख लो, आप यही लिख लो, कोई दिक्कत नहीं. It occurs in the duodenum also, but also in the ileum. So remember, ileum is a point. If you want to remember only ileum, remember. अगर दोनों है तो दोनों का भी मार्क कर सकते. सिंगल बेस्ट पूछेंगे तो yes, single best is ileum. Okay, it is occurring with the help of intrinsic factor which is produced from the parietal cell. Okay, clear हो गया वो बात? Okay, parietal cell. So deficiency of B12 is seen with what? Can anybody tell me deficiency of B12 leads to which one? It is also leads to megaloblastic anemia. It will lead to megaloblastic anemia. What is that? It will lead to megaloblastic anemia. Okay. Along with the megaloblastic anemia, dear students, it will have, what is that? It will have, most importantly, it will lead to something called as neurological symptoms. So neurological symptoms क्यों आता है? Neurological symptoms, I'll explain why it will come. Neurological symptoms due to lack of myelin, because myelin synthesis के लिए आपको क्या चाहिए? For the synthesis of myelin you require B12. If B12 is not there, myelin will not be there. So neurological symptoms such as peripheral neuropathy. So peripheral neuropathy which is affecting your both the limbs and legs. इसीलिए उसको stock and glove neuropathy भी बोलते हो. Stock and glove neuropathy is nothing but which involves your hands and legs, and patient will have glossitis, inflammation of the tongue papillae, and patient will have ataxia. Patient will have its symptom ataxia. Patient will have, what is that? Ataxia. Loss of balance is possible. Okay, so these are the symptoms associated with the megaloblastic anemia. Now the next important aspect is that there is a increased level of methylmalonic acid, and also there is an increase of homocysteine in the blood. Increase of homocysteine in the blood. So increase of homocysteine in the blood. So that is the story of your, what is that? Vitamin B12. Last but not the least, the vitamin which we have left out is vitamin C. Vitamin C are also called as ascorbic acid. Okay, ascorbic acid. So when we are speaking of ascorbic acid, it is found where? In the citrus fruits. It is found where? In the citrus fruits. What is the function? Fruits. It is citrus fruits. It helps in the post-translational. Yes, post-translational modification. What is that post-translational modification of which protein? कौन सी protein को post-translational modification करवाता है? Vitamin C. Post-translational modification of modification of what is that? Yes, of which one? Yes, come on, quickly tell me, everybody. Very good, all of you are correct. It is the post-translational modification of the collagen. Okay. So post-translational modification of the collagen is done by your ascorbic acid. Is done by your ascorbic acid. So that is the story of your post-translational modification. Deficiency leads to which disorder? Yes, of course. Deficiency leads to scurvy. डेफिशिएंसी लीड्स टू स्कर्वी. व्हाट इज दैट? स्कर्वी. तो स्कर्वी में क्या कर लेते हो पता है? यहाँ पे ट्रैप में फंस जाते हो. सर गम ब्लीडिंग, गम ब्लीडिंग, गम ब्लीडिंग, गम ब्लीडिंग, एक ही पॉइंट याद करके जाओगे. इफ आई एम द एग्जामिनर, उसमें गम ब्लीडिंग ऑप्शन ही नहीं, मतलब वो सिम्टम ही नहीं लिखूंगा. आई विल नॉट राइट द सिम्टम एज गम bleeding itself. I will give other clinical feature and ask you which vitamin deficiency. You'll keep on searching only gum bleeding, तो ट्रैप में फंसोगे. ओके, नहीं फंसना है. ठीक है. सो there can be hemorrhages under the skin. Hemorrhages or rashes in the skin. So skin के अंदर small bleedings are possible because collagen is the protein which is present in the basement membrane of a capillary. तो अब collagen ही not working properly because lack of vitamin C. If collagen it's not working properly, automatically capillaries will undergo damage, which will lead to what is that? Bleeding. Okay. Then also in the children, my dear students, if there is a increase of bleeding time. Bleeding time is increased. Okay, bleeding time can be increased. Then next one is that in the children, यहाँ पे कौन सी bones होते हैं sir? Which bones are present here? They're called as your carpal bones. So carpal bones develop नहीं होता है, so they can lead to defect of carpal bone development. Okay, defect of carpal bone development. Okay, then there is one more thing called as scarvatic rosary. There is something called as scarvatic rosary is possible. And one important, there will be swelling in the gums, sir. What is that? Swelling in the gums. What is that swelling in the gums? That is only gum swelling and also bleeding. Gum swelling and bleeding both are possible. So itna sare symptom, these many symptoms are there. If we rely only upon gum bleeding, then we will get confused. I don't want you to be confused. So gum bleeding is one of the clinical feature along with associated many other clinical feature. That is the story of your, what is that, sir? Story of your vitamins. Quick revision. Okay. So quick revision only we are doing. All right. So let's go to the next one. Vitamins is done. Let's go to the enzymes. Enzymes के अंदर आप लोगों को 3 important things we will ask. What is competitive inhibitor में, non-competitive inhibitor में what happens to Km and Vmax? Non-competitive inhibition, what happens to Km and Vmax? One more concept is coenzyme, cofactor and prosthetic group in the enzyme. Okay. So let's understand. All enzymes are proteins. If all the enzymes are proteins, bacho, what is the function of the enzyme? So enzymes are responsible for biological activity. Okay. So enzymes are proteins. Okay. So now these enzymes are proteins means made of amino acids. Agree. So enzymes are a biological catalyst. They're a biological catalyst. So if they're a biological catalyst, let's consider this is a structure of an enzyme. So in this enzyme, there is one important site, substance A is coming and getting converted into B. So some conversion is taking place in this site. I will call this as catalytic site, are also called as active site. Catalytic site are also called as active site, and the other place, if something can come and bind, we will call it as a allosteric site. Sir, what is that? Allosteric site. Okay. Now when we are speaking of enzymes, let's talk about one simple thing. Substance A is getting converted into substance B by some enzyme. उसका नाम देते हैं E. Let's keep the enzyme name E. So this conversion occurring, यहाँ पे here there is no inhibitor, nothing is there. Okay, so nothing is there. So during that time, what I'm trying to do is, sir, what I'm trying to do, I'm trying to plot the rate of the reaction and concentration of the substrate, rate of the reaction and concentration of the substrate. So as reaction starts, as the reaction start, it will slowly rise, conversion speed will rise, speed will rise, speed will rise, speed will rise. It will reach a maximum velocity. It will reach a maximum velocity. I will call it as Vmax. I will call it as Vmax. So rate of the reaction ka maximum velocity it can reach in the absence of a inhibitor. In the absence of a inhibitor, I will call it as velocity maximum. Okay, first I found a Vmax. After that, I find the half of the velocity. Half of the velocity. So that is only Vmax ka the half of the Vmax. At the half of the Vmax, I will plot and I will check the concentration of the substrate. I will call it as a Km, which is also called as Michaelis-Menton's constant. Michaelis-Menton constant. Michaelis-Menton's constant. So what is Michaelis-Menton constant? That is nothing but your Km. Agar Michaelis-Menton constant is there, now enzyme inhibition will occur. Matlab, abhi now substrate A is also trying to bind. Now if I introduce this inhibitor, matlab if I add a inhibitor, how will the reaction change? How will the reaction change? Or this graph will change? Let's understand. So for every reaction we will have a Vmax. For every reaction we will have a Km. This can be changed. ये change हो जाएगा. कब change होगा? Whenever there is a introduction of inhibitor. Inhibitor बीच में आएगा. If the inhibitor comes in the middle, automatically there will be change of Km and Vmax. Okay. So how does this Km and Vmax changes? So पहले enzyme inhibition के बारे में पढ़ते हैं. Enzyme inhibition can be irreversible, and one more thing can be reversible. Okay, one more thing can be reversible. So in the reversible, my dear students, I have two types: competitive inhibition and non-competitive inhibition. In the irreversible, क्या होता है? Once enzyme is blocked, the enzyme is blocked forever. If that enzyme activity is needed, मतलब reactivation नहीं होता है, there is no reactivation of the enzyme in irreversible inhibition. There is no reactivation of the enzyme. But reversible में क्या होता है? Reactivation is present. Reactivation is present. Okay, so now how it will affect, let's understand. In the competitive inhibition and in the non-competitive inhibition, वो कैसा काम करता है inhibitor, and what happens to the Km and Vmax, let's learn, sir. Okay, so there was one reaction. So normally the reaction was going on like this. Okay, so here is the rate of the reaction and here is the concentration of the substrate. So reaction was going like this. It has reached a maximum velocity. So I will call this point as a Vmax. I will call this point as a Vmax. Iska आधा half of the Vmax I will find and I will plot it. And I will find something called as Km. कोई एक reaction का Km I found it out. कोई एक reaction का Km I found it out. So after I find the Km, what will happen? Let's see. So now enzyme is there. Okay, now enzyme has an active site. Active site में substrate is also trying to bind. Active site में substance A is also trying to bind. And inhibitor is also trying to bind. So both of them are competing for the same active site. So what will happen? The reaction will take place. Yes, sir. But velocity rises slowly. Slowly. But at one point, of course, it will reach the maximum velocity. If I increase the concentration of the substrate ज़्यादा होगा. If more substrate is there, substrate will only bind to the enzyme. So leading to reach of the Vmax. So after reaching the Vmax, now if you look at यहाँ पे देखो Vmax तो achieve करोगे. Vmax remain normal, constant Vmax. But what happened to Km? Km is increase of Km. That is only your Michaelis-Menten constant. इसी चीज को हमने कैसे पढ़े थे? याद है? How did we study? So consider there was a person. तो कोई मतलब some girl joined the coaching institute. So she wanted to prepare. उसका plan ऐसा था. Her plan was the original black color line. मैं पूरा prepare करूंगी. I will reach the maximum velocity of my preparation and I will do my exam. That was our plan. Okay, and pass the exam. So now what happened is that two guys like the same girl. Okay, now दोनों जाएंगे उसके पास. So one person went and asked, "Hi, can we go out?" Okay, तो वो लड़की को मतलब उतना दिमाग में नहीं था, ओके चलो विल गो फॉर लंच डिनर, कुछ तो बाहर गए, ठीक है। अदर डे अदर गाय गॉट पिस्ड, दूसरों को गुस्सा आ गया, तो ही वेंट एंड सेड अरे चलना मूवी देखने चल, ठीक है। सो इन दिस बिटवीन दिस टू गाइस what happened to our preparation, our preparation became slow, so slowly she was preparing, okay, because of this two. Now somewhere here यहाँ पे कोई एक पॉइंट आया था, ग्रैंड टेस्ट आ गया या नहीं तो कोई टेस्ट आ गया, टेस्ट में मार्क कम आ जाता है, so in the test she scored less. As soon as she scored less in the test she realizes okay I'm getting disturbed by these two, so now what I should do, दोनों को क्या करेंगे, भैया कैसे हो बोल देगी, okay, she will call भैया for both of them and cut them both and prepare our own preparation to reach the Vmax. इसको ऐसा पढ़े थे हम लोग, okay. So here preparation became slow but reach the target, so reaching of the target will be there, reaching of the target will be there, Vmax will be achieved, but Km will be increase of Km, okay. So increase of Km is only for your competitive inhibition. Let's go for the non-competitive inhibition, okay. Non-competitive inhibition. So non-competitive inhibition, now originally reaction was supposed to take place like this, originally reaction was supposed to take place like this, so this will be your something called Vmax and here will be your what is that, Km will be there, Km will be there, okay. Now what happens, reaction is taking place, reaction is taking place, substrate is trying to bind to the site A, but I will take a different approach, I will inhibit the allosteric site, so here I will add the inhibit, okay. So reaction will take place, but reaction can never reach a maximum velocity. Why it can never reach? Because inhibitor is bound, but it is bound to a different site and completely it has what, it has reduced the reaction, that is why we will call it as Km. So is there any change of Km? No. But what happened to Vmax, original Vmax versus the new Vmax, under the influence of which one, under the influence of non-competitive inhibitor, so Vmax will be reduced. Reduction of Vmax with a constant Km, with a constant Km is seen with what is that, is seen with your inhibitor. Which inhibitor? That will be your non-competitive inhibition, non-competitive inhibition, okay. So that is the story of your competitive and non-competitive inhibition. Koi confusion? I hope it is clear. I hope it is clear. I hope it is clear. I hope there is no confusion, I think. So, uncompetitive inhibition or non-competitive inhibition, Km will be constant, Vmax will be decreased because the inhibitor is not competing for the same site. Rather, inhibitor is trying to inhibit the allosteric site. Means inhibitor is binding to the different site. Okay. All right. So that finishes our what is that, enzyme. That finishes our what is that, enzymes. So let's go to the next important part of the enzyme discussion. Let's discuss. So what is the next important? Here I have written competitive, increased of Km and Vmax is same, non-competitive Km is same and decrease of Vmax. This part you have to remember. Then the last but not the least in the enzyme we have called as coenzyme, cofactor. What is a coenzyme? What is a cofactor? Coenzyme and cofactor, both of them help the main enzyme. Help the main enzyme. Main enzyme जो भी होगा, whatever the main enzyme is there, both of them trying to help the main enzyme. Okay. But coenzymes are made out of organic substances. Coenzymes are made out of organic substances such as vitamins. Cofactors are made out of inorganic substances. Inorganic substances. For example, we have, let's imagine that is your iron. Okay. For example, that is, let's imagine your manganese. Okay. So they are helping the main enzyme, but if they're organic compounds, we'll call it as a coenzyme. If they're inorganic compound, I will call it as a cofactor. Okay. So organic examples, for example, we have vitamins. We have vitamins. So vitamins are example, classic examples for what? A classic example for your, yes, that is for your coenzyme. The last but not the least in this one, which one? Yes, that is prosthetic group. Prosthetic group. Prosthetic group. Okay. अरे क्या हो गया, किसी का माइक अनम्यूट हो गया, देख लो. Okay, now prosthetic group मतलब क्या है? Enzymes are proteins. All enzymes are proteins. All enzymes are protein. So all enzymes are protein means all the enzymes are made out of amino acid. All the enzymes are made out of amino acid. इसके साथ अगर मान के चलो I will add some, for example, let's keep I will add iron. तो iron is present, is outside of the enzyme, is present within the enzyme. ये बताओ, is now in this case scenario, this is an enzyme I will call. If I call this as an enzyme, now iron is present within the enzyme or it is separately, freely is located. Come on, tell me. No. The plots are not important. They are present within the enzyme. So they are present within the enzyme. What is this prosthetic group? Non-protein part of the enzyme. Prosthetic group is what? Non-protein part of the enzyme. Non-protein part of the enzyme is only called as your prosthetic group. Non-protein part of the enzyme is only called as prosthetic group. So I have given, there are multiple investigations. There are some enzymes which you can use for the investigation, which we have discussed. I'm not going to waste your time on that one. Okay. So let's talk about few questions are there. I think Delhi batch has solved this question. So just for my satisfaction, let's solve this question once again. Quickly answer the questions. Come on, first question. Yes, glucose 6 phosphatase deficiency in the von Geekers disease. Okay, let's go to the second question, sir. Complex 4 inhibitor. Complex 4 inhibitor is which one? 2,4-dinitrophenol, amibarbital, TTFA, and 2,4-dinitro. So there is somebody's. Nah, no need to remember the classification. Who will ask? Based on the function, you can classify the enzymes into 20 different types. Oxidases, reductases, epoxidases. You don't have to remember that, dear. Okay, don't panic. Very good. That is your cyanide. Which of the following is not a microelement? Calcium, because calcium is not a microelement because daily requirement of the calcium is very high. Copper requirement is very small requirement. Zinc is very small requirement. Okay, so which is not a microelement? That is your, of course, that is your which one? That is your, of course, that is your calcium. Okay. Which of the following pathways only takes place in the cytoplasm? Cytoplasm में कौन कौन होता है? Only your, what is that? Only your glycolysis. यहाँ पे fill कर लो. Beta oxidation कहाँ पे होता है? In the mitochondria. Tricyclic acid cycle occurs in the mitochondria. Urea cycle occurs in the mitochondria and the cytoplasm. Mitochondria and the cytoplasm. Glycolysis occur only in the cytoplasm of the cell. Okay, let's go to the next one. ANP acts through. ANP usually is its secondary messenger is CGMP. So let's go to the next question. Peripheral conversion of T4 to T3. This question, come on. The answer is deiodinase, not deaminase, deiodinase. Very good. Okay. A postmenopausal woman presents with the pain in the first metatarsophalangeal joint after the intake of alcohol. The drug used to in this case acts by which mechanism? So she is having a gout. So we give which drug? Allopurinol mechanism of action inhibit xanthine oxidase. The answer is A. Very good, sir. So remember which of the following activities are low in riboflavin deficiency. I want you to remember what is that? That is your glutathione reductase activity. It's a fact-based thing. Okay. What happens after a disease? What happens after a meal? After you take a meal, blood glucose rises. So blood glucose rises. So because of that, what will happen? Come on, increase in the insulin and decrease of the glucagon. But that is after the intake of the food, more glucose goes to the blood. More glucose going to the blood, it will activate. Which one? GLUT2, which is located in the beta cell of the pancreas, causes the release of the insulin. Okay. Menkes disease is caused by what? Deficiency or copper excess? Menkes disease is caused by copper deficiency or toxicity. Menkes disease confused mat hoइएगा. That is your, what is that? That is your copper deficiency. Menkes disease is due to copper deficiency. Menkes disease is a copper deficiency due to mutation of ATP ATP 7A gene, ATP 7A gene, ATP 7A gene. Okay, ATP 7B mutation is seen with what? ATP 7B mutation with Wilson disease. Wilson disease. Wilson disease में होता है copper toxicity is seen with Wilson. Copper toxicity is seen with Wilson's disease. Okay, a person present with diarrhea, dermatitis, and dementia. What is the probable cause? Probable cause 4D disease, pellagra. Very good. 4D disease, pellagra. A vegetarian presents with anemia and hypersegmented neutrophil. ध्यान से सुनो, he is a vegetarian. Okay, he is a vegetarian with anemia and hypersegmented neutrophil. It is a megaloblastic anemia caused by due to which deficiency? Usually in the vegetarians, it is a deficiency of which one? B9 or B12 deficiency? B12 deficiency. Micronutrient that is deficient in the post-ileal resection. So as you told, post-ileal resection, B12. Okay. A person with alcoholism history for 20 years. Carcinoid syndrome is totally different here. Carcinoid syndrome is a condition in which abnormal growth is present, like a cancer, in which there is an elevated level of serotonin. If there is an elevated level of serotonin, patient will develop symptoms such as blood pressure changes, recurrent flushing in the face, flushing, okay, small vasodilation, and also patient will have high level of serotonin, vomiting, and patient can also have, what is that? Patient can also have, remember, that is your mitral valve prolapse. That is your mitral valve prolapse. Hope that is clear, Viren. तो यहाँ पे थोड़ा ध्यान से देखो, थोड़ा ध्यान से देखो सर, ध्यान से देखो. क्यों क्यों रश कर रहे हो? बायोकेमिस्ट्री का क्लास में साइकेट्री का क्वेश्चन नहीं पूछा जाएगा क्या? इन बायोकेम क्लास आई वोंट आस्क साइकेट्री क्वेश्चन और व्हाट? Alcoholism for 20 years. He avoids alcohol for 2 days, presents with agitation, global confusion, disorientation, hallucination. Fever is high, high BP, diaphoresis and autonomic act. After the withdrawal of alcohol is getting high BP, diaphoresis, autonomic activity involvement. So the answer is delirium tremens. Delirium tremens. Okay. So he developed these symptoms after stopping of the alcohol. Okay, so delirium tremens, because it is a withdrawal of alcohol. See, in the Wernicke's encephalopathy, no autonomic nervous system symptoms. ANS symptoms नहीं होंगे sir. ANS symptoms, tremors and all is associated with delirium tremens. हाँ, ये बताओ sir. A patient with chronic alcoholism presents with confusion, ophthalmoplegia, ataxia. So now your answer is correct. That is your vitamin B1. That is your vitamin B1. Very good, sir. Very good. Very good. Neutral lipid, which is stored in the liver, I want you to remember it as a fact. The neutral lipid is your triacylglycerol, that is triglycerides. Triacylglycerol are triglycerides. So let's go to the last but not last question, I think. Let's look at this. So a group of friends planned a trip to Ladakh. On one of them started having a headache and nausea, dizziness, exhaustion symptoms when they're there, not while going, when they were there. So when they're there, that time if it is occurring, what is the drug of choice for the mountain sickness? Very good, sir. All of you are correct. Acetazolamide. What is that? Acetazolamide. Okay. Let's go to the next important question. A person brought 2 bottles of liquor from the shop and presented with drowsiness, ataxia, and blurred vision. What is the antidote? With the 2 bottles of liquor, he got ataxia and blurred vision and drowsiness. The answer is this is a methanol overdose. This is a methanol overdose. The antidote for methanol is famiprazole or ethyl alcohol. Famiprazole or methyl alcohol. Okay. Flumazenil काम पे use करोगे sir? Used for benzodiazepine overdose. Naloxone is used for what, sir? Naloxone is used for your opioid overdose. Opioid overdose. Very good. So that is a story of your biochemistry rapid revision. Hopefully that was useful. I have discussed all the important parts of the biochemistry which can be asked as a MCQ. Hope you understood everything. Okay. So now once we are done with the biochem discussion, थोड़ा अब बात करते हैं एग्जाम के बारे में. Let's talk about exam. See, guys, now is a time where you are going to feel like, sir, क्या करें, कैसा करें? ऐसा मतलब like what to do? We are getting scared. The days are becoming less and less. Sir, as we go closer to exam, listen to me very carefully. As we go closer to exam, my dear students, what you need to do is that you don't have to make your brain torturous, मतलब by सी न्यूक्लिक एसिड्स के अंदर मैं काम पे हाईलाइट किया तो उसको एक बार देख लो. एज सच न्यूक्लिक एसिड्स हैव बीन वेरी फ्रीक्वेंटली नॉट आस्क्ड, इसीलिए हम लोग रैपिड रिवीजन में नहीं करवाते क्योंकि टाइम वोंट परमिट. ओके, दैट इज फर्स्ट थिंग. सेकेंड थिंग क्या होता है कि इतना लास्ट 2-3 इयर्स में फ्रीक्वेंटली न्यूक्लिक एसिड से क्वेश्चंस उतना नहीं आया. सो योर प्रायोरिटी कैसा होना चाहिए? प्रायोरिटी अभी मैंने जो सिस्टम्स करवाया हूं, वट एवर द सिस्टम्स आई हैव डन नाउ, गो थ्रू दैट. ओके, गो थ्रू दैट. बाद में टाइम मिलेगा तो न्यूक्लिक एसिड्स का रिविजन कर लेना बस. समझ में आया? Understood? So first you go through this material, what topics, what I have done so far. Later, if you get time, you go through the nucleic acid. Okay. Now what you have to do, sir, is see every subject के अंदर very quick glance of the revision करना है. You don't have to do the whole thing. Don't have to do the whole thing. Glance करना है because you have studied already. Now just fastly go through the notes. That is first thing you are supposed to do. I am thinking that you have solved. So you will be solving the question. Make sure you have done your PYQs and all. Okay. And this is the time, सारे every person will feel scared or anything. So my one simple word you remember. Our brain was never designed for studying. Our brain was always designed to do what? Eat, sleep, and have sex. That's what our brains are designed for. That's how any primates are there. Primate brain is there like that only. So you have come so far with all the hard work you have done. Okay. Now, if we have left out some topics or anything, try to do as much as possible. Try to do as much as possible. नहीं हुआ है, I will leave out the full subject. वो मत किया करो. At least, for example, let's imagine one small subject you had left. You didn't study. If you didn't study, at least do the rapid revision of that one and QRS session of that one and go. That will help you. But don't leave out the whole subject and go. ओके. एंड सर वॉट एवर वी रिवाइज हम भूल रहे, अरे भूलने दो, टेंशन मत लिया करो. मैं एक वन सिंपल थिंग आई विल टेल यू. You can never recall the notes completely, my dear students. Please remember, you can never recall the whole notes completely word to word. Okay. So all you have to do is what? All you have to do is that when you look at a question, are you able to solve the question? Okay. And make sure what pattern of mistake you are making. All of the following except में हो रहा है. Okay, which pattern of mistakes you're making, make a note out of it and make sure you don't do that mistakes once again. That is one thing. Okay, the feeling of being forgetting another subject, it is quite normal thing. Don't be scared, you just keep pushing forward. Okay, padhte chalo padhte chalo padhte chalo. What happens is that on the day of exam there comes a question, you don't have to recall the whole topic or whole complete subject. For that, all you have to recall is that concept. Agar ek bar do bar, one time or two times if you have studied, definitely your brain will recall that question and it will be able to answer. Thoda give little bit confidence. Keep confidence on your brain. Okay, because your brain is definitely is going to recall you the information. Okay, that is the important thing. And most importantly, don't go changing the content now. What exactly happens is that here itna content mean this small content only it will happen, in this content only it will happen, that and all is not going to occur like that. Okay, only if you have learned the subject, that is a different story. Now you do not change whatever the notes you have made, and especially you would have made I'll revise these points in the last minute. You would have made focus on that one. What you have made is the best notes. Okay, not by somebody selling the notes and all. Don't fall for all of it. Go with your flow and go with your material. Okay, that's one thing. Okay, and the next thing is that make sure all the last 3 years FMGE questions you have solved. Make sure you have solved last 2 years NEET PG questions. Last 2 years NEET PG and last 3 years FMGE questions of each subject. I want you to complete it. Okay. And sir, time ko kaisa divide kare? You have completed your subject, all the subjects are done now. Now all you have to do is that keep the half day and a half day you take one main subject and go with it. Another half day you keep one more parallel subject. First half of the day one main subject, second half of the day like one minor subject, and that major subject while you are doing, do the MCQs of that one, and don't do the MCQs of chapter wise, rather do the MCQs subject wise. Finish one subject completely, after that only solve the MCQs. Okay, daily solve at least 50 to 60 MCQ, that will be sufficient. Okay, but when you are solving the MCQs, all you have to do is follow that particular pattern. Is what the particular pattern is? You complete the whole subject and do the questions of that subject. Okay, so you have done so much fantastic work. Okay, now is the time where you have to believe in yourself ki yaar, I have done genuine effort, I will definitely do it. And most importantly, have little bit of faith in yourself. Hope आएगा यार. You, like, are, like, we have seen so many things being in FMGE, and एक एग्जाम के लिए डर के बैठने से कुछ नहीं होना सर. ठीक है. द डे विल कम, जनवरी 12 आएगा जरूर, एग्जाम हॉल के अंदर वी विल गो, वी विल राइट द एग्जाम. इसमें कोई ऑप्शन नहीं है. डू नॉट गेट मच स्केर्ड. Be scared little bit. Having too much of scared is dangerous for you. Okay, don't panic yourself. Okay. And koi, like, other people told that idea, this idea I will do. Do not experiment any ideas right now. Okay, just follow the material, what you have studied, what you have learned, what you have made. That's all is needed. Okay, so there are a lot of sources for your MCQs, which I have already taught to every, I have said to every batch how to solve, what to do and all. Okay, so be confident. अरे तुम्हारे ऊपर हमें कॉन्फिडेंस ज्यादा है यार. वी हैव मोर कॉन्फिडेंस ऑन यू पीपल. आई डोंट नो अबाउट you guys, but definitely we have given a good work of teaching, and you people have done a fantastic job. At least my subjects, I have made sure you people have remembered the things in the classroom itself, be it in Delhi, be it in Chennai, be it in Trivandrum, be it online batch. For every batch I have done that. तो इतना याद रखने के बाद अगर कोई गिव अप नहीं करेगा, एंड कोई लास्ट में आके सर मुझे आई एम स्केर्ड सो आई विल स्टॉप रीडिंग, आई विल नीड मोर टाइम, इफ यू आर फीलिंग दैट, कॉन्टैक्ट मी. Okay, nobody is stopping preparation at this particular crucial time, because sir मेरे से नहीं हो पाएगा, I need more time, I'm okay, I will write the next attempt. If you have that plan, delete that, because next attempt maybe 1 day before exam is there, 1 hour before exam is there, 1 minute before exam is there. ओके, सो ये सब आते रहेगा. गो विथ ए फुल कॉन्फिडेंस. जैसा तुम लोग लड़कियां लड़कों को अप्रोच करने, लड़के लड़कियों को अप्रोच करने में कितना कॉन्फिडेंटली जाते हो ना, उतना ही कॉन्फिडेंस से जाना है. ठीक है. अगर कॉन्फिडेंस नहीं है तो काम नहीं होगा वहां पे. लाइक दैट ओनली. इफ यू डोंट हैव कॉन्फिडेंस इन योरसेल्फ एंड इफ यू आर गेटिंग स्केयर, डर में गलतियां ज्यादा होते हैं सर. समझ रहे हो बात? डर में गलतियां ज्यादा होता है. तो कीप योरसेल्फ काम. एंड मैं वन मोर आई विल टेल यू, one more last one thing I will tell you before I leave you guys. Our brain is like one's computer has the information kahan pe, where it is stored we don't know, but when needed it will definitely vomit. Okay, means it will definitely give you the information. So when you are recalling also, so you are not sure, but your brain is telling you, I feel like this is the correct answer. If your brain is telling that, please go with your instinct. Why? Because if we would have read it somewhere once, and maybe we don't know, actively we don't remember, but brain is trying to help you by giving the information which you have read maybe one time. So please do not keep on changing the answers, sir. Okay, answers badalna nahi hai. Okay, this is a very important key point. All right, so with this much being said, I hope that biochem is टुडे. ठीक है जी, भेज देंगे, कोई दिक्कत नहीं, आ जाएगा. you'll get the notes, no problem. So I hope all of you are doing well. Make sure your health is fine. वो health is very important. Make sure to keep your healthy. Okay, thank you so much guys. See you people in the next upcoming. कोई ना कोई सेशन तो होगा ही होगा. कुछ नहीं होगा तो एग्जाम के 1-2 दिन पहले फिर से आप लोगों से मैं बात करूंगा. ओके. अरे वर्मा परांठे, क्या याद मत दिलाओ यार. गौतम नगर में होता तो मैं भी खा लेता हूँ. एनीवेज, चलिए, बाय बाय, गुड नाइट, थैंक यू. स्पокойной नोचे, शुभ रात्रि. थैंक यू. बाय गाइस, बाय बाय.